Hey,
Hello, everyone. I'm Dr. Maria Salas, and I'm subbing for Dr. Mo tonight. Shout out to Mo for being such a badass and running her first marathon this weekend. Talk about creating ketones, right? See what you can do.
yeah,
If you create ketones, you can say yes to marathons and train for them and all of that. Oh my gosh. Um, so
yeah.
I just happen to be a chiropractor as well. I've been helping people for over 22 years. I would say to help them feel better and to help them with their overall health. And Dr. Mo said, "Hey, Maria, can you sub for me tonight? Make a case for ketones." And I said, "Sure, I will do that for you." And so tonight, I'm not asking anyone to believe me. I'm not asking anyone to change their life tonight. I'm simply asking you to act as the jury. Okay. So let's look at the evidence together. If the evidence makes sense, then perhaps ketones deserve a place in your health toolbox. So, ladies and gentlemen of the jury, let's examine the evidence tonight. Okay, so Exhibit A, the current state of health. So, how many of us know somebody with type 2 diabetes? You could raise your hand or put it in the chat. Type 2 diabetes, pre-diabetes, right? Insulin resistance, obesity, dementia, Alzheimer's, depression, anxiety. So, of course, I'm going to add chronic pain because that's my business, and fatty liver. People get their blood work back and they said, "Ooh, the doctor said I had fatty liver." High blood pressure. And then, of course, I have to throw this one in there because it's very personal to me, but endometriosis, PCOS. And then we're going to talk a little bit about that later on tonight. So, despite having more medications than any generation in history, we are getting sicker. So maybe we should ask a different question, like, could some of these conditions share a common root problem? Exhibit B. This is leading me into Exhibit B, the metabolic system. So the body is made up of approximately 37 trillion cells. Every single one of these cells needs energy, okay, especially the nervous system. The energy factories inside the cells are called the mitochondria. You've heard this before. If mitochondria struggle, tissues struggle. If tissues struggle, then organs struggle. And that means the job of that organ struggles, okay? And so if the organ struggles, then what you see are symptoms, okay? Symptoms all of a sudden appear. So then what if chronic diseases are actually energy problems? So think about that, okay? So and then, of course, I brought some more evidence here, guys. Why did I find this paper on PubMed 2015, Transgenerational Inheritance of Metabolic Disease? Transgenerational inheritance. That's not, oh, Dr. Maria, I have diabetes because my mom had diabetes and my grandma had diabetes. No, that's more what their study was about epigenetics, how behaviors and environment can cause changes that affect how our hormones work, right? So transmitted from parents to offspring over multiple generations because of habits and environment, okay? And then again, I found another paper. Oh my gosh, we were going to talk about PCOS, right? Guess what? Why did PCOS officially has been changed? The name has been changed to polyendocrine metabolic ovarian syndrome. You guys, just in the last 3 weeks, this happened on the Lance. You can look it up yourself. It was published in the Lance about 3 weeks ago. If anyone wants these papers, just let me know. But why would they change the name? Okay, because before, if it was ovarian cyst, they were just concentrating on the ovaries. Right now, they're going to look at behavior and
Mm.
and environment. Okay, which leads me to Exhibit C. Thanks, guys. I'm getting so excited now. I'm all hot and sweaty. Okay, so what is insulin resistance? Okay, the simple version is imagine your cells are a house. Insulin is the key, glucose is the guest. After years of excessive sugar and processed food, carbs, and an increased toxic load, I'm adding that like whatever you've been around exposed to. After all that time, the lock becomes rusty. The key stops working efficiently. The pancreas makes more insulin. The body stores more fat. blood sugar rises, circulating blood sugar rises, and the metabolic system becomes stressed. Not surprising, right? Which leads us to exhibit D. This is my favorite part. This is my favorite section. Have you guys ever, do you guys love a plot twist? I do. Okay, when you're watching a movie, this is the plot twist right here. The human body was never designed to run on one fuel. Isn't that exciting? We have a hybrid engine. That's two gas tanks, guys. Two of them. We can run on glucose and we can run on ketones. So think about glucose as that fast acting, ketones is very efficient, okay? Well, ketones are produced when insulin drops, the liver sensing that. The ketones are also produced when fat is burned, and ketones are produced when the liver converts fat into ketones. Okay, so our ancestors entered ketones naturally. They entered in this state of ketosis in a very natural way, not because it was trendy, not because we saw it on Instagram, but because food wasn't always available 24/7. Okay, no refrigerators, no pantries full of food, right? Which leads me into exhibit E. And this was me, guys. So I'm doing these programs right alongside of you because I've had some issues. So instead of coffee and then crash and then snack and crash, many people are experiencing steadier energy levels when they create ketones, okay? Which now leads me into exhibit F, the brain evidence. Here we go. And then Dr. Mo talks about him all the time. This is where Dr. Christopher Palmer comes in. Quote, for over 100 years, ketogenic, this book is called Brain Energy, by the way. For over 100 years, ketogenic therapies have been used for the treatment of epilepsy, especially if the person wasn't responding to meds. Okay, so quote again, today researchers are studying metabolic approaches for brain disorders like epilepsy, Alzheimer's, mild cognitive impairment, depression, bipolar disorder, schizophrenia. Are you guys getting some hope here? Because I am. Okay, so this basically leads to why do ketones matter? Why do we want to make them? Well, because they stabilize blood sugar. Okay, they stabilize it. So you have, instead of all these spikes when you eat certain foods, you'll have fewer insulin spikes, fewer crashes. For me, this is what happened. I was less hangry. And then this is also what happened for me. I had less afternoon fatigue. Okay. So I don't know if for you guys, if it was right after you ate lunch and then you had that fatigue at like 2 or 3, that was what was happening to me. And that has lessened. And I am so happy about it. Maybe I haven't lost a ton of weight like Julie, you're going to hear her. But if I have more energy, oh my gosh, and I'm feeling better, that is huge for me. So what it also did was appetite control. So many people report fewer cravings, less snacking, and feeling satisfied longer. Also, this was huge for some of the people that joined my group. They had more mental clarity. So many people described like, oh gosh, I could think again. This foggy brain was lifted and I feel more focused. And then this next one, obviously the increased energy also came with increased creativity, which I thought was super interesting to me. When you can increase ketones, lower your glucose, and get that really awesome glucose to ketone index, and you actually enter into a therapeutic state of ketosis. People are writing books, they're writing poems, they're starting programs, right? They're becoming area manager like Julie. So all of these amazing things are happening, and the research is just continuing, and it's very encouraging. So leading us into exhibit G, why protein matters, and hence why Dr. Mo created this animal-based, protein-based coaching. And this section is super important because it really leads into the actual food piece of it. So protein and food in general is like information to the body, okay? So the building blocks of protein are amino acids. And those amino acids build and repair muscles, hormones, neurotransmitters, enzymes, and immune tissues. So if you're not getting enough protein, you're asking your body to rebuild itself without the proper building materials. Okay. Exhibit H, why healthy fats matter. The building blocks of fats are fatty acids. Okay. Healthy fats help build cell membranes. Where do you think the mitochondria live, right? Hormones, brain tissue, and nervous tissue. So don't be thinking like, oh, fat on the body, but the brain is made up of fat. So it loves glucose, but it also is very works very efficient with ketones. This leads me to exhibit I. What ketosis is not. Okay, so just like the flyer you saw with this, it's not eating bacon all day, it's not butter in your coffee all day, and it's not starving yourself. Okay, buying processed keto food like those bars, never eating vegetables. That's not what this is about. It's actually a state of being. So just like I said, you're getting your glucose so low and you have to test yourself, and you're getting your ketones so high, and you're creating that index, the glucose to ketone index. It's an equation, and it means that you're eating real food. To get there, it means you're eating real food. You're actually leading with protein. You're leading with healthy fats, and this will help stabilize blood sugar, and it creates that metabolic flexibility that you keep hearing. Well, what is metabolic flexibility? It's actually being able to go back and forth from those two gas tanks. Like, can I use glucose right now because I need it really fast? Can I go back into ketones because I got myself, so low in glucose that my liver's like going, hey, yeah, we can use ketones. So being flexible, okay? So people ask like, oh, do I have to eat like this forever, or do I have to be on this forever? Well, no, try to create this flexibility between those two gas tanks, okay? So now how you guys are wondering, how do I make ketones? Well, simple. Okay, step one, you are eating enough protein, like what we talked about. And this program makes it super easy. Dr. Mo created a really amazing sort of like graph that tells you, everything that you could possibly eat. And it's very personal and custom because not everyone likes the same things, and then the other thing too is we like to use the Arbonne tools. We're Arbonne ambassadors. Of course, we're going to use the Arbonne Simply One, and some people are going to use the Essentials protein powders to help them get through the day as tools. Okay. So, but we're also step two, you have to really reduce the carbs and sugar, and I'm going to say the processed foods as well. So all those shelf stabilized plastic foods, you want to get those out. Step three, you want those healthy fats. So the MCT oil, okay, this is one that we're going to recommend that you buy. Avocados, walnuts, pecans, ghee, grass-fed butter. We have the list for you. We make it super easy. Okay, it's part of the coaching group that you get all the recipes and lists of food. Step number four, move your body. Okay, first, you want to just make sure that you're doing stuff that you like. Okay, if you're a walker and a hiker, great, do that. I'm going to tell you that you might want to increase it the volume just a little bit to make the ketones. So like a HIIT workout, high intensity interval training will do it. I don't care if you run sprints, if you like that, if you walk sprints. I'm actually teaching people to walk faster. That's another way of doing it. Norwegian 4x4 is great. Number five, allow time in between meals. So if you just tell yourself in the beginning, if you start this, don't make it hard. Okay? This is easy. You actually probably are halfway there already. Stop eating by 7. Use the light of the day. Stop eating with the light by 7, and then don't eat again until like 7, 8, or 9. You can take your time though, do baby steps, okay? Um, and that's what this coaching group will teach you how to do. It'll also help you how to measure the ketones, okay? And with that, we're going to talk about the ketone strips, and all the information is there. Okay, so after reviewing all of this evidence, I believe ketones deserve consideration. That's my belief, not because they're trendy, but because my metabolic health matters and your metabolic health matters too. So, and we improve metabolic health with every system of the body when we create ketones. So blood sugar improves, energy improves, inflammation often gets taken off the body, brain function improves, and quality of life improves. So right now I want to transition to my friend Julie. Now that you've heard some of the science, right here, science becomes so much more powerful when it changes a real person's life. So I'd like to introduce my friend Julie, and she's going to share with us. Julie, thank you for being willing to share your story with us tonight.
Thank you so much. I love this. And I hope that you can sense our passion for this because our health has been changed and we want everyone to know. And truly, I want people to know that you can heal. If you set your body up for success, you can heal. And my story started about 12 years ago when I was diagnosed with Hashimoto's. And at the time, really, I was just having some joint pain and back pain. And then I just went to the doctor for a checkup and they said, you have this, and here's your medication. And by the way, you'll take it for the rest of your life. There was no mention of lifestyle or diet changes. I barely knew where my thyroid was, and I certainly didn't know what it did. And that was okay with me at the time, honestly. I didn't ask for more, and I felt better on that medication for years. And then an Arbonne entered into that equation, and I felt really good using the Arbonne products. And then 2020 hit, and the stress of that on my own life, on my relationships, really created kind of a storm in my body. And then my dad passed away unexpectedly, and I started to gain weight really rapidly. My muscles just kind of disappeared so fast, and the joint pain returned. But I didn't attribute it at that time to Hashimoto's. I just thought I'm lazy, I'm getting older. Um, my feet hurt really all the time, and I kept buying new shoes thinking that that would help them, but nothing helped. And it was about a few months after my dad passed away, my family got together and planned this hike, this really strenuous hike to the top of a family property, which is like a dome, a granite dome. And I knew at that time that I would not be able to make it. I was in terrible shape physically and emotionally, honestly. And so we planned it a year out so that we could get in shape. And I started going to the gym, and I was really a regular participant in these HIIT classes, and nothing happened. No weight came off. I didn't notice any increase in muscle. And so pretty soon I went to a functional medicine doctor. I paid out of pocket because I really felt like they would help me where the my traditional doctor was not helping me. And I asked her, I went there with the intention to heal my thyroid. And I asked her, is this possible? And can you help me? And she said, yes, it is possible, but it's really hard. And truly, that was all I needed. I just needed that teeny bit of hope that it was possible to heal. And so she recommended a paleo autoimmune type of diet, which really did help for the first 6 months. I stuck very closely to that. My diet became very limited. It was like a protein, a tiny bit of greens, a little bit of sauerkraut, and sweet potatoes. And that really was my diet for probably 5 months. And I did lose 25 pounds. And then I did the hike and I made that trek. It was very strenuous, but I did it. And I was the only one from my generation to do it. So I just feel so grateful that I was able to honor my dad in that way. And then shortly after that, I discovered the glucose factor and I started monitoring my glucose and realized that how I had been eating, while it did give me some initial results, it wasn't going to continue in my healing process, especially for the Hashimoto's side, because I was still having the antibodies at that time. And so I just changed my diet even more. I cut out the sweet potatoes. That was like the first thing. My body can't tolerate them. My blood sugar shoots way up when I eat them. Some people can, but I cannot. And so I really dialed it in closer to an animal-based way of eating with healthy fat, lots of protein. And over the course of about 5 more months, I put my Hashimoto's was put into remission and I lost 25 more pounds. And really, I didn't know why until Mo came to me with this program. And she had been working on the sidelines developing this program because she, as a scientist, knew the power of ketones and the healing power of ketones. And I saw her program and I was so excited because she made it so simple. And that way I could share it with my friends, with my family. I shared it with my sister instantly because she asked me about it. And I said, this is exactly what I did without knowing that it was this program. And so I just want to share that whatever why whatever the reason you're here, if it's an autoimmune condition or a disease or um, insulin resistance, which is what I think that I had, and I still battle that. I think it takes it's a process to heal from that. But there is hope. And so it does take work. The journey was long. It was not just a 30-day thing. It was long. So if you have healing to do or weight to lose, give yourself, play the long game. Don't just play the 30-day game because that is not really sustainable. You want to play the long game, and there is hope for you. Thanks for letting me share.
Oh my gosh, thank you so much, Julie. I just, every time I hear your story, I just get so much hope, and I hope people do as well. I mean, I think it's super important I am still working on stuff for a long time. Like, I mean, I lift every day. Like, I have my workout. I mean, it's just, it can be frustrating. So we just want to give people hope because it took how long for you to get this way, right? So give yourself some time to peel back the layers and clean things up. So, thank you again, Julie. And now we want to talk next steps. So, if you're listening to this call later or right now, get with the person who invited you or shared the call with you to help you place an order of maybe some Arbonne tools. Have them add you to the next Arbonne, or pardon me, animal-based coaching group. That will help. And then we talked about ordering the urine ketone strips because Mo in this program teaches off of urine ketone strips, and then the get the organic MCT oil. Sorry, we can't give like coupons for those. We just got them off of Amazon, and we have the links for you, so don't worry about that. Um, but those are the things that you're going to want to do to make sure that take the next steps. Okay. And then, so I just want to end with the verdict isn't whether ketosis is right for everyone. The verdict is whether your current approach is giving you the results that you want. Okay. And if not, perhaps it's time to consider another piece of the evidence, right? So what if the answer for help was there all along, and all you needed to do was help your body remember to use that second gas tank? Okay, guys, I just want to say thank you, Julie, and thank you for being here tonight. Until next time.
All right, thanks, Maria.